Welcome to week 5, the life cycle of an insurance claim. Processing an insurance claim is when the CMS 1500 claim is used to report professional and technical services. The information from the super bill, or patient record, or chart is then transferred to the CMS 1500 claim. An accepting assignment is when a provider agrees to what the insurance company allows and or approves as payment. The patient is responsible for the co-payment and the co-insurance amounts. The signature on file can be used as a substitute for the patient's signature as long as the real signature is on file. An assignment of benefits is where the patient or the insured authorizes the payer to reimburse the provider directly. An accounts receivable management is where it assists providers in the collection of the appropriate reimbursement for services rendered. When it comes to managing new patients, there has to be office policies and procedures regarding paying co-payments and regarding scheduling. They have to determine whether the appropriate office has been contacted. The patient has to complete a patient registration form upon arrival, and also photocopies of the patient's insurance card front and back need to be made. You also would have to contact the payer just to verify insurance, and also you would verify information with the patient or the subscriber themselves. When it comes to primary versus secondary insurance, primary insurance is that plan that is responsible for payment of the first claim. And then after the payment of the primary insurer, the secondary is billed. For example, children of divorced parents, then if that child has insurance through the divorced parents, one of those parents are primary, one of them are secondary. And the same goes for if a child is living with two parents and both parents have insurance, then one of the parents will be primary and one of them secondary. When this happens for primary and secondary insurance, you would need to create a new medical record for the patient. It would generate the patient's encounter form, and the encounter form is a financial record that documents treatment, diagnoses, and services. Managing established patients, and those are patients who continue to come, to their regular doctor visits to the same doctor, they are considered established. You would schedule a return appointment when the patient is checking out or when the patient calls the office. You would verify all registration information, collect the co-payment, and the encounter form needs to be generated for the patient's current visit. Managing office insurance finances. The CPT and the HCPCS Level 2 codes are assigned to the procedures, and you would enter the charges for services and our procedures and post those charges to the patient's account. This is the life cycle of an insurance claim. And after the patient comes into the office and the doctor sees the patient, there is a submission of the claim where it goes through a processing to the payer, and then the payer adjudicates the claims, and then when they adjudicate, they either pay or deny, in which the physician or provider would hope that it would be payment. As far as claim submission, there is an electronic or manual transmission of claims data to ensure insurance payers or clearinghouses, public or private entities that process or facilitates the processing of non-standard data elements into the standard data elements, or convert standard transactions, which is the electronic remittance advice received from payers, to non-standard formats. Now, when you're doing electronic claim submission, that is going through our electronic data interchange. That's where it's computer-to-computer transfer of data between providers and third-party payers, or providers and healthcare clearinghouses in a data format agreed upon by sending and receiving parties. When you receive or when you send those claims, there could be claim attachments. And those claim attachments could be a medical evaluation for payment, or past payment audits or reviews, or quality control to ensure access to care and quality of care. Also, claims processing is sorting claims upon submission to collect and verify information about the patient and provider. In the claims adjudication, the claim is compared to payer edits and patient health plan benefits to verify. Common data file is an abstract of all recent claims filed on each patient. Allowed charge is the maximum amount an insurer will pay for a service. Also, deductible is total amount of covered medical expenses a policyholder must pay each year out of pocket before the insurance company is obligated to pay any benefits. The co-insurance is the percentage that patient pays for covered services after the deductible has been met and the copayment has been paid. For a payment of a claim, once the adjudication is complete, the claim is paid or denied. And then a EOB, which is an explanation of benefits, is sent to the patient and the policyholder, because you as a patient would want to know whether your claim was paid as well. The remittance advice is sent to the provider, and the remittance advice goes straight to the bank. Your money goes straight to the bank, and the remittance advice actually shows the provider all the claims that were submitted, which ones were paid and which ones were denied. And the ones that are paid will have a total, and that is the total of the amount that went to your bank account. Prompt payment laws provide specific time frames in which claims must be paid. Maintaining claim files. CMS requires claims and copies of attachments to be kept for 6 years. This includes open claims, closed claims, remittance advice files, and unassigned claims. Tracking claim submission. Effective claims tracking requires the following activities. There are non-covered service rejections, rejections for errors, non-covered service rejections, and rejections for errors. Appealing denied claims. Remittance advice indicates that the payment was denied for reasons other than a processing error. You would want to go in and review those denials to see if you can appeal and provide the correct information needed in order to get that claim paid. Thank you, and that is the end of the lecture.